Welcome to History, Chief Complaint, and Status of Chronic Conditions or Diseases. I'm Dr. Michael Warner with Patient Advocacy Initiatives. Let's start off with 3 quick questions. Going to the doctor can be a challenge. It's hard to keep your head straight and properly express yourself. It's common for people to forget to address a concern during a medical visit. Many will remember what they meant to say while they're on the way home. Medical providers may also have a hard time keeping up during a medical encounter. While you express your concerns, the doctor may be typing what you say while at the same time thinking of more questions to ask. The advent of electronic health records, EHRs, has brought more burdens to doctors, as everyone in the health field has given the doctor an additional box to click on. This series will help you prepare for a meeting with a medical provider. By understanding the rules, you will be able to better work with your healthcare team. In the last module, we addressed the chief complaint and the history of present illness. The HPI, as you recall, allowed you to describe details of a new problem. But what if your problem is not new? What if you have been treated for hypertension, high blood pressure, for the past 10 years? Rather than rehashing when it started and how you felt at the time, which would be done with an HPI. Remember, location, quality, severity, duration, timing, context, modifying factors, associated signs and symptoms. You would update your condition or conditions with a status of chronic disease or conditions. You would first start with the chief complaint. Remember, the chief complaint is a short description of why you are seeking medical attention. If you are seeing the doctor to follow up on the care of your hypertension, you do not want to list your chief complaint as follow-up, check-up, or even check blood pressure. If you are being seen for the evaluation and management of hypertension, then your chief complaint can be hypertension. It's okay for you to say high blood pressure. If someone has multiple diseases that are to be discussed with a medical provider, the chief complaint could look like CC for chief complaint, hypertension, hyperlipidemia, hypothyroid. It could also say CC, high blood pressure, high cholesterol, low thyroid. Given a status report does not have strict descriptors like history of present illness. Status of chronic disease or condition, or status of chronic diseases or conditions, is open-ended and simply asks you to express what is going on. A status for hypertension may read, home blood pressure readings good, 126/72. I take my medications and have no side effects. A status for hypertension, hyperlipidemia, and hypothyroid could combine to read, I take all of my medications and have not had any side effects. My blood pressure runs 126/72, fasting sugars are around 118 that I check 3 times a week, and I got blood tests last week at Memorial Medical Center's lab. For those of you who know about federal health policy and regulations, the status of chronic disease and condition was added as a feature to the 1997 Evaluation and Management E&M guidelines. Though they were not part of the original 1995 E&M guidelines, the United States Centers for Medicare and Medicaid Services, CMS, allowed status of chronic disease condition to be credited toward both 1995 and 1997 guidelines as of September 10th, 2013. The trick with the history is that you can only have one per medical encounter. If you have a new problem, then it can be addressed with the chief complaint and supported with a history of present illness. If you also are receiving care for chronic conditions, they too can be addressed in the chief complaint and then added as a status of chronic disease or condition. It may be difficult to figure out whether a problem is an old condition, represented as status, or a new problem that would be represented as a history of present illness. Let's say the person with left elbow pain started having severe numbness into the 4th and 5th fingers. Is this status of elbow pain that now includes severe numbness into certain fingers? Or is the numbness a new problem? We could have debates about this. But wait a second. If we are debating whether new symptoms are an expansion of a known condition status or whether they're a new problem that needs to be addressed with an HPI, then you are deep into understanding how documentation occurs in your health record. Congratulations! I'm glad you are participating in these educational modules. Let's discuss review of systems in our next module. For now, kindly answer 3 quick questions.